Today, we're going to break down a really powerful treatment that's used for certain rheumatic diseases. It's called Therapeutic Plasma Exchange, or TPE. So let's jump right in and figure out exactly how this works. You know, think about that for a second. It's a pretty wild question, right? Your immune system is supposed to be your personal bodyguard. But what if it gets confused and starts, well, attacking you? That's the exact problem we're going to tackle. So, what is actually going on inside the body? Well, for some people, the immune system just goes a little haywire. It starts cranking out these harmful proteins, these antibodies, that aren't fighting off germs. Nope, they're mistakenly attacking the body's own healthy tissues, and that can lead to some really serious complications. And this isn't just some abstract idea. It's a very real situation for people who have severe or treatment-resistant rheumatic diseases. And that word refractory, it just means that other standard treatments haven't quite done the job. This is where TPE comes in, especially for conditions like lupus or antiphospholipid antibody syndrome when things are really flaring up. Okay, let's be super clear about who the villain of this story is. It's these abnormal antibodies. They're the target. You can think of them as proteins that have just lost their way, and now they're causing all this damage instead of protecting you. The entire goal of the treatment we're talking about is to get them out. So it makes sense, right? If the problem is in the blood, the solution has to be in the blood too. And that brings us to therapeutic plasma exchange. Honestly, the best way to think about it is like a very sophisticated cleaning for your blood. Here's the official textbook definition. You might also hear your doctor call it plasmapheresis. Same thing. The procedure does exactly what it sounds like. It literally exchanges your plasma. It takes out the part of your blood that has all those bad antibodies and swaps it with a replacement. And this comparison just makes it all click. Look, before the treatment, your plasma is just swimming with those harmful antibodies. But after TPE, poof, that harmful plasma is gone. It's been removed and replaced with a clean substitute. It's a really direct, almost mechanical solution to a very complex problem. All right, so we know what it is and what it does. But what's it actually like to go through this procedure? Let's walk through it, step by step, from your perspective. Okay, let's break it down. First, a special IV called a central line is put in, usually in a large vein so they can move blood in and out safely. Then your blood is drawn out and sent into this amazing machine. That machine acts like a centrifuge, separating your plasma from everything else, your red cells, white cells, and so on. Now here's the most important part. That plasma, the part with all the bad antibodies, just gets discarded. It's gone. Finally, all your good stuff, your blood cells and platelets, are mixed with a clean replacement fluid and returned right back to you. Now, this isn't a super quick procedure. You should expect each session to last somewhere in the ballpark of 2 to 3 hours, so you'll want to get comfy. And it's usually not a one-and-done kind of thing. To really get those antibody levels down, a full course of treatment often means doing this 5, maybe even 10 times over a couple of weeks. Okay, so the procedure's over. What now? What happens after the exchange? Let's talk about safety and what you might expect to feel, because that's obviously super important. Most of what people feel is pretty mild. You might feel a little cold, which makes sense since the replacement fluid is at room temperature, maybe a little nausea or some tingling in your lips or fingertips. And yeah, feeling tired afterward is very, very common. I mean, your body just went through a pretty big process. But, and this is a big but, it is absolutely crucial to know when something you're feeling is more than just a typical side effect. There are a few key things that should make you pick up the phone and call your medical team right away. So you really want to be on the lookout for these signs. A fever or chills could mean an infection. Any chest pain or heart palpitations, definitely call. Same goes for severe cramps or numbness. And of course, anything that looks off with that central line, like redness, pain, or any bleeding, needs immediate attention. Now, I want to pause here for a second because this is huge. For anyone who is pregnant or might be thinking about it, this is an incredibly important and reassuring piece of information. Knowing that this is considered a safe treatment option can make a world of difference. This brings us to maybe the most important part of this whole thing, your role. You are not just a passenger on this journey. Your communication with your healthcare team is absolutely essential for this to work safely and effectively. And you might be wondering, why do they need to know about the vitamins I take? Well, because the plasma exchange process doesn't just pull out antibodies. It can also pull out medications that are in your bloodstream. So your team needs to know about everything. Prescriptions, over-the-counter stuff, supplements, the whole shebang. It's all about keeping you safe. And here's one more really critical piece of information to share. If, for any reason, personal, religious, whatever it may be, you avoid blood products, you have to let your team know. That way, they can plan your treatment with a replacement fluid that works for you. So there you have it. We've seen how therapeutic plasma exchange literally goes in and removes the source of the attack in some of these tricky autoimmune diseases. It's a really direct, powerful tool. And the big question, the one you'll need to answer with your doctor, is whether this tool is the right one for you right now.